Welcome back to Body Beautiful, and we're welcoming Dr. Chester Cheng. We'll be taking any of your calls with questions you might have about plastic surgery. The number to call, 800-440-4884. And again, we'll be putting the number for the doctor's office up and during and after the segment, so be ready with your pen and paper to write that number down. Remember, any advice we give you today, you want to double check with your own physician. Welcome, Dr. Cheng.
Thank you. Pleasure being here.
You are a plastic surgeon. You said that there are really two types of patients that you're treating. Only two?
Two broad categories. One category is the rejuvenation patients who are looking to restore their youth. So after time, after sun damage, sometimes after pregnancy, there's changes to the body that occur, and people are looking to rejuvenate or turn back the signs of aging.
We're all fighting gravity.
Gravity and time. And the other category is to contour or to change a shape or to change a part of the body. So that could be anything from the contour of the body, a feature on their face, a nose, maybe setting the ears back.
So if we could divide folks into like a slightly older group who are fighting the ravages of time,
Sure.
and then the other maybe a little bit younger, and they're just trying to correct what they perceive as something that is
Sure.
not as attractive.
Yeah, so genetically, like a younger patient may have been from their inherited a feature from their parents. They could have a bump on their nose or
oh yes, familiar with that.
prominent ears. There's a lot of different things. The shape to the body. Those are genetically genetic conditions or traits that they have that are from their parents. The other condition, with aging, when somebody just with gravity's effects and the loss of skin elasticity, we start to age, and the other category of patients are the older patients who want to turn back the signs of aging.
Now, there seems to be kind of a dilemma here. Do you recommend, is it you go straight for injectables, you start kind of working that way, or do you go right to the surgery? Is each patient different?
Each patient is different, and it's age-related also. So the best thing a young person can do is to prevent. So good moisturizers, good sunblocks, internal hydration too. Drinking a lot of water, not letting the body dry out from the inside too, is all part of it. So there's things that we can do to just take care of the skin. So before we start to have the sagging of the skin, we can prevent just the condition and the quality of the skin from getting overly exposed to the sun.
It's refreshing to hear you talk about preventive maintenance before we actually have to get to, taking the car in, opening up the hood, figuring out what's going on there. Did genetics come into play at all? Because I know some people who, pretty much do not treat their bodies well, and somehow they have to bounce back.
Genetics plays a huge role in how we age. So there are just different types of skin. Sometimes the oily skin, although there are conditions that oily skin has, that maybe acne could be a problem with oily skin, but sometimes some of the oily skins tend to age less fast. But as we age, then we start to, after the preventative maintenance, we have Botox and some of the fillers, and then we go to some of the more invasive things like laser or some of the chemical peels, and then we get into the surgical procedures.
All right, so we'll say if someone in their 50s, early 50s, wanting to look a little younger, would they be falling into the facial rejuvenation category, maybe the injectables at first, or what do you recommend?
Each person is very individual, so the best thing is to have an individual consultation. But generally speaking, if somebody has never had any kind of rejuvenation procedure, it's best to start in the eye area, because when we age, aging is a gradual process, and the eyes and brow area of the face shows the signs of aging, the earliest. And coming up, I think we have a picture which will demonstrate that.
We have some terrific pictures, and certainly it shows work on the body and on the face. But just briefly, because we do have to go to a break before we do that and take some of the calls that are rolling in. I guess the big question a lot of people have is, this is an investment. This is an investment of money. It's an investment of time. It's one of those things that I guess you weigh out whether, but people are still on a self-improvement kind of track, are they not? Are they just trying to be their better selves?
Everybody has features that they're born with, and people, as we age, we start to lose some of the quality of the skin. We start to have the sagging or the drooping of some of the facial volume. So when we talk about facial rejuvenation, we're restoring the position of the soft tissues and taking away some of the extra skin, all in making somebody look natural, and it's all about proportions and balance.
Yeah, and I imagine, boy, when you get those results, it's awfully nice to wake up in the morning and say, okay, I look like I actually rested. Wow.
Yeah.
All right, well, we'll be back in a bit. We do want to show those pictures, but in the meantime, for more information about Dr. Chester Cheng, call 925-736-0401 or go to plasticsurgery1.com. And the first 30 callers to Dr. Cheng's office who mention the show Body Beautiful will be able to receive $75 off any Medi-Spa treatment. That includes the injectables, laser hair removal, Fraxel laser treatments, facial, or microdermabrasion. Once again, his number, 925-736-0401. Welcome back to Body Beautiful. We're here with Dr. Chester Cheng, plastic surgeon. We'll be taking your calls about plastic surgery. The number to call, 800-440-4884. I can get that out. Remember, any advice we give you today, you're going to want to talk to your own physician as well. Before we take your phone calls, and there are quite a few here, let's get a look at some before and after pictures. We have a before and after of an eyelid surgery. Explain what just happened here.
This is a patient who came in, and she would be well rested, just back from a vacation, and her friends would be commenting on how tired she looked. So she always hated that comment, and what she needed was just a little upper and lower eyelid procedure in which we can remove some of the lower lid puffiness, which often casts a shadow, which some people relate to as, you know, the bags under the eyes. So we take away some of the orbital fat and take away some skin from uppers and lowers, and we're able to have this nice refreshed look.
Talk about refreshed, almost like a different person. We also have a before and after tummy tuck, and this is this from having babies? Is this what
generally it is from having babies. The other reason why somebody would have excess skin is from large weight losses, weight gains and weight losses. So when the skin has gone beyond its elastic limits, we can have stretch marks. And after the baby's born, if the skin doesn't spring back within a year or two...
It's not likely to?
Yes.
Oh, okay. Well, that looks pretty good. We have one last set here. Let's go. It's a neck liposuction.
Yes, this is a procedure in which, through just a small little hole, we're able to contour and shape the neck and restore that youthful look to the neckline. This patient was young enough that fortunately she had the good skin elasticity, so it's very important to have that good skin elasticity. Otherwise, a neck lift is combined with that
Dr. Cheng, we've got to get to some of these calls. I have Cindy from Oakland. Are you with us this morning?
Yes, I am.
Hi, Cindy. You have a question about eyes?
Yes, I do. I've always had... Yes, I am.
Oh, hi, Cindy. You're with us. You're on the air live.
Hi.
Hi.
Dr. Cheng?
Yes.
I've always wondered about... I've always had dark circles around my eyes, and I'm an African-American woman, and I'm dark complexioned, but I've always had these raccoon type of circles around my eyes, and I've been using all kind of over-the-counter eye cream, and I put so much.
And nothing's working.
It may say just a little, but is it genetic, or is it something that I can really do?
Sometimes it is genetic. A lot of times it could be irritation of the lower lid skin, but to come on in and have a evaluation, sometimes the laser can help that. So the laser, we're able to use the Fraxel laser, which is a really good laser that helps not only just skin color discoloration under the eyes, but with melasma from pregnancy. It's a very good treatment that helps with skin coloration problems.
Thanks, Cindy from Oakland. With the other calls, we are running out of time again. Elizabeth from Atherton has a question about light melasma. What is that? Can we answer that for her?
Melasma quite often is from its pigmentation problems or discoloration problems, and they're usually hormonal. So from pregnancy or from even birth control, people can have these pigmentation problems. We have a laser in the office which addresses that problem, and it's very effective. effective. It's called the Fraxel laser.
All right, thank you, Dr. Cheng. We are out of time, but for more information about Dr. Chester Cheng, call 925-736-0401 or go to plasticsurgery1.com. And the first 30 callers to Dr. Cheng's office who mention the show, Body Beautiful, will be able to receive $75 off of any MediSpa treatment, and that includes injectables, laser hair removal, Fraxel laser treatments, facial or microdermabrasion. Once again, his number, 925-736-0401. Thanks for joining us. See you next week.